Hi, everyone. My name is Allison Spensley, and I am both a doctoral student at the University of Alabama, Birmingham, and a global health leader passionate about the concept of empowerment. I'm going to start today with an image. I first saw this image in a magazine, and I was completely mesmerized. The colors, the texture, it's incredibly beautiful. I couldn't stop looking at it. And as I read the story about the photograph, I was amazed. As it turns out, this is a photograph of poop. That's right, human feces. Photographed with an advanced technique I couldn't even begin to describe, the image captures, for me, the importance of perspective and possibility. Seeing things in a different light, changing the view, opening up imagination and inspiration. I know it seems like a lot to ask from a single picture, but when I look at it every day, that's what I see. To me, this is magic. I wanted to bring this magic to women working in global health, to provide an opportunity for women to envision additional possibilities for themselves, to expand their ideas of the future, and to inspire creativity. In the design of my project, I considered the challenges women face in the workplace, striving to move ahead in our professional journeys toward larger leadership roles while encountering structural barriers that limit our forward movement, balancing personal commitments and responsibilities, which can include a family, raising children, and caring for aging parents. And all of this while trying to create change and improve this world in some small way. I also considered our strengths as women. We thrive through connection and common experience. While none of us have perfect solutions, we share ideas, approaches, and strategies. We seek advice and insight from women leaders who have blazed the path before us. But what about women working in global health that don't have access to a broader network and don't have the connections to receive insight from women that have successfully navigated the journey? There is a gap in providing accessible, valuable, real world advice related to the whole self journey for early and mid career women working in global health. I refer to whole self because both our professional and our personal roles are deeply intertwined and impact each other. To address this gap, I wanted to create a resource that is free, requires a limited time commitment, and is available regardless of someone's geographic location. The resulting product is a podcast entitled Spark. Each episode of Spark will feature an intimate conversation between the podcast host, me, and a senior or executive level woman leader in global health, where we explore and talk about the guest's whole self journey that led to where she is today. Guests will bring diverse perspectives based on their differing identities, personal situations, and experiences. And while each guest story is different, common themes are explored, including approaching key decision points, professional and personal challenges, and lessons learned. When we talk about challenges women in leadership face, they can seem vague, intangible, even insurmountable. But when we hear these same topics in the form of a conversation with an actual living woman leader who has lived through them, our brains have the capacity to absorb and understand the information in a different way. Space for possibility is created. Spark utilizes evidence from the fields of neuroscience and psychology to put the saying, seeing is believing, into action. Spark is designed to provide an opportunity for women, 1 hour at a time, to envision additional paths for ourselves and expand ideas about our future. Spark provides the fire of imagination with an abundance of fuel. This fuel, in the form of personal stories, powers the imagination to life, allowing us to consider our whole self journeys with different perspectives. This project represents a small facet of empowerment, and I suspect it's clear I'm pretty passionate about it. The leadership journey over the past year has allowed me time to clarify my purpose, which is supporting women, adolescents, and girls in their whole self journeys in whatever form that may take. Uncovering this purpose has led to the creation of Spark. It has helped me to define my dissertation, which is centered on women in global health leadership, and it has led to a confidence in this purpose that was missing from my life. The leadership journey has been filled with magic, and it has allowed me to experience the power of imagination, inspiration, and possibility. And I fully intend to bring this magic to others. Thanks so much.